So hi everyone, welcome to Narco Studio Room powered by Indian Society of Critical Care Medicine. Today we are being with an eminent personality, Dr. Rajarshi Roy from Manipal Hospital, Kolkata. So welcome to Narco Studio Room.
Welcome. Thank you very much.
Yes. So my question is, how do you manage drug-resistant candida infections in the ICU?
First of all, the drug resistance candida happens because there is some immunocompromised personnel and they are having exposed to the multiple antibiotics, and the duration of antibiotic therapy is usually more. Definitely whenever, but the pickup rate of candida is very low. If it is from the urine, we can ignore, but if it is from candidemia, that means the sample is in the blood as well as in the endotracheal culture or something, you have to treat it aggressively when you are being treating for. The first line would be if the patient is in shock and it is candida, first line would be echinocandins, no question about it.
All right. And what are the best practices for preventing the fungal infections in bone marrow transplant patients?
For all transplant, selectively for the bone marrow transplants, you have to have a coverage of antifungal therapy because the colony count is very low. They are having very much immunocompromised state, as well as this marrow production, that is the new RBC, new WBCs are coming out in the newer generation, the periphery. That's why if the patient is stable throughout, definitely you start with a posaconazole. Or isobuconazole is a good choice. It covers some higher generation, higher level of candida also. But yes, of course, if the patient is unstable and they are having some kind of very low count as well as exposed to antibiotics, you need to switch off to the other echinocandins. It should be liver friendly echinocandins first.
All right. And what are the treatment options in patients with early post-engraftment and late post-engraftment fung infection?
It's a very tricky question because the choices are various. The patient's quality and the risk are very important. If you are considering how early it is, that has been very, very individualized. And if the colony count is less than 500, the treatment protocol and the patient is hemodynamically stable, definitely you give posaconazole, isobuconazole, that now I said, according to the body weight. That is very important. Do not underdose for those people who are post-transplant and this aggressive therapy, because this is very important for the body weight people, and according to this, the best practice is give optimum dosage and optimum therapy for them.
Thank you so much, Dr. Rajarshi sir, for sharing your insightful thought with all of us, and thank you so much for coming here, and we are so delightful for having you here.